What if aging was not only a countdown, but a race? Longevity escape velocity is the idea that medical progress could one day add healthy years faster than biological aging takes them away. Not as a magic cure, and not as a promise that exists today, but as a scientific target. The grounded question is not whether we can live forever. It is whether we can delay the years when disease, frailty, and loss of function take over. This is where geroscience matters. Researchers are studying whether age-related diseases may share common biological roots. The goal is to extend health span, the years of life spent with strength, independence, and cognitive function. That distinction matters. The most useful question is not, can we live forever? It is, can we delay the period of life where disease and disability take over? And here the science is already more grounded. One major research direction is drug repurposing. Rapamycin is one of the most studied examples. It affects a pathway called mTOR, which helps cells decide whether to prioritize growth or repair. In mouse studies, rapamycin has repeatedly extended lifespan, including when started later in life. That is scientifically important. But it does not mean healthy people should take rapamycin for longevity.
Geroscience is the reason this question is scientifically interesting. Instead of treating heart disease, diabetes, frailty, and dementia as completely separate problems, researchers ask whether shared aging mechanisms can be measured and slowed before disease takes over. The target is not just longer life. The target is more years with strength, cognition, and independence.
Human evidence is still developing, and the drug can have side effects. Metformin, GLP-1 receptor agonists, SGLT2 inhibitors, senolytics, and other candidates are also being studied for their effects on aging-related biology. Chronic inflammation, cellular senescence, mitochondrial dysfunction, DNA damage, changes in nutrient sensing, and declining repair systems. But this is also where we have to separate science from hype. Animal studies, biomarkers, and human outcomes are different levels of evidence. A treatment can look promising in a lab and still not be proven to slow aging in healthy people. Biological age tests may be useful, but measurement is not the same as control. So the practical message today is Healthspan. Build and preserve muscle. Protect sleep. Some of these medicines already have evidence for specific diseases, but proving that a treatment slows aging itself in healthy humans is much harder. Why is it hard? Because humans live a long time. So researchers need reliable biomarkers, ways to estimate biological aging before waiting a lifetime for results. This is one reason AI has entered the longevity conversation.
The evidence is promising, but uneven. Animal lifespan studies, disease-specific human trials, biomarkers, and AI pattern detection can all teach us something. But none of them automatically prove that healthy humans can slow aging safely. A biomarker has to predict outcomes that matter. And if it changes, that change should reflect real health, not just a younger-looking score.
AI can help analyze enormous biological datasets from blood markers to genetics. The hope is that better measurement will help researchers identify who is aging faster. But measurement is not the same thing as control. A biomarker must be validated. This is where we need to separate the science from the hype. The science says aging biology is real, measurable, and influences major diseases. The hype says we are on the edge of guaranteed immortality, or that one supplement stack can reverse aging. That is not where the evidence is. Longevity escape velocity remains a hypothesis. It may become more plausible if things improve together, better biomarkers, safer interventions, and stronger human trials. But for viewers today, the most powerful longevity strategy is still not exotic. It is Healthspan. Build and preserve muscle to buffer against frailty.
For viewers today, the practical strategy is Healthspan. Protect muscle, sleep, cardiovascular fitness, metabolic health, nutrition, prevention, and social connection. These are not as dramatic as immortality claims, but they are the foundation that may let people benefit from future breakthroughs. The best longevity strategy is still the one that keeps function intact.
Protect sleep, which affects immune function, cognition, and metabolic health. Train your cardiovascular system. And manage the basics that quietly drive risk: blood pressure, blood sugar, cholesterol, and inflammation. Eat to support metabolic health with protein and fiber, and stay socially connected. Loneliness and chronic stress affect biology, and use medicine where it is already proven. Screenings, vaccines, dental care, and mental health. This is real. This is actionable. So, are we close to longevity escape velocity?
So are we close? Not yet. But aging is becoming measurable, targetable, and more connected to preventive medicine. That is a real shift, even if the hype runs ahead of the data. This video is for education only and is not medical advice. If you are considering any medication, supplement, or longevity protocol, speak with a qualified.
Sleep. Train your cardiovascular system. Manage blood pressure, blood sugar, cholesterol, smoking, alcohol, and sleep apnea. Eat in a way that supports metabolic health. Stay socially connected. Use proven screening and medical care when risk factors appear. Maybe the first great longevity breakthrough is not living forever. Maybe it is staying healthy long enough to meet the next breakthrough. This video is for education only and is not medical advice. If you are considering any medication, supplement, or longevity protocol, speak with a qualified healthcare professional.
Qualified healthcare professional.
The honest answer is not yet, but we are entering a new phase. The future of medicine may shift from reacting to disease after it appears toward preserving function before decline becomes irreversible. Maybe the first great longevity breakthrough is not living forever. Maybe it is staying healthy long enough to meet the next breakthrough. And that is why the real question is not only how long we can live, it is how well we can live while science learns how aging